Hi there, this is Dr. Paul Firnhaber. It's a new year and it's time for another 10 minutes of truth, which means it's Wednesday around noon. So today I'm going to be discussing a very important article that came out in December, this past December, so it was last month. It's in a journal called Spinal Cord. And the name of the article is Neck Pain a Marker for Something Serious like Myelopathy. So let me just explain what myelopathy is. And they call it in here, they refer to it as degenerative cervical myelopathy. Now, this is a chronic progressive condition of the neck, of the cervical spine, that leads to compression of the spinal cord. Degenerative cervical myelopathy is one of the most frequent causes of spinal cord dysfunction in the elderly. And I'm just going to say this as I see it a lot in practice. Degenerative cervical myelopathy, or they call it DCM, is a clinical and radiological diagnosis that presents with a whole range of symptoms. And it can range from neck pain and stiffness all the way to paralysis and everything in between. These changes, the degenerative changes, are linked to osteoarthritic changes in the intervertebral discs and the joints of the vertebra. And again, these are things that I see every single day in practice. The progression of DCM can be slow and insidious, with symptoms worsening gradually over time, which I see a lot. And this is why I tell people, once you get your neck corrected or once things get better, it's really important to keep it up and to maintain that correction, because otherwise our bodies have a tendency to degenerate over time. And that's what this article says. Now it says, as a spinal cord becomes compressed and damaged, a range of neurological symptoms can develop, including chronic pain in the neck or paresthesia, or numbness and tingling in the upper limbs, which again is something that I see a lot in practice. Now here's a really important point that the article makes. It says persistent neck pain is believed to be a predictor of degenerative cervical myelopathy. So if this is predicting cervical myelopathy, don't you think that if you have neck pain, that needs to be corrected? And that's, again, these are things that we work with in our office day in and day out. Now, the article goes on to say that the intervertebral disc in the cervical spine start to degenerate over time. They undergo age-related degeneration. This produces structural changes in the neck. It can cause you to lose the curve. It can cause the curve to reverse. It can cause too much curve in your neck. And it can cause actual scoliosis. And what happens over time, if you allow this to happen, and it doesn't have to happen, is this can cause pretty serious symptoms in the body. Now it says all of these changes that I just talked about, individually or collectively, can be associated with pain. Now the article makes a very good point here, and it says this: it's important to note that not everybody with degenerative changes in their neck experiences pain. That's very true. I've seen that many times. And some people may have degenerative changes on x-ray without any symptoms at all. I've seen that. However, just because you don't have symptoms doesn't mean that doesn't need to be corrected, because if you let that go, those degenerative changes will get worse and cause symptoms over time. Now, the article makes a very interesting statement here. It says pain can be influenced by various factors, such as the extent of degeneration, that's true, overall health, lifestyle, cultural factors, and individual pain thresholds. And essentially what they're saying there is the kind of life that you lead, and the health of your body can really determine a lot about the amount of pain. So let's say that you don't exercise and you eat a standard American diet that's high in sugar, in seed oils, and ultra-processed foods. That's a recipe for inflammation in the body. Anytime you have degenerative changes in the neck, you're going to have inflammatory changes. But if you have a lifestyle of poor eating habits, this is going to enhance that inflammation and make things a lot worse. Another thing is lack of exercise. No tone in your spine can make these problems worse and can make the problems happen a lot faster. And one of the problems I see in older adults, and I see it all the time, is a lack of consistent exercise. And I would say even meaningful exercise. In other words, most of the time you're going to have to do more than just take a walk. All right? So these are lifestyle factors, these are health factors that can really influence the way that degenerative cervical myelopathy affects you. Now, another thing that it says, another really important point, at the macrovascular level, the degenerative change of the spine may compress major feeding arteries. So one of those arteries in the neck is a vertebral artery that goes up the neck and supplies the brain, the base of the brain, with blood. We know as for a fact, we have absolute research evidence on this, confirmed by MRI studies, that when you lose the curve in the neck, that changes the amount of blood flow to the brain. And so you can have a compromised blood flow to the brain along with the degenerative cervical myelopathy. And once you lose that curve in the neck, which you can get back, but it takes some work, that changes the blood flow to the brain and can influence things like, brain function and dementia. Now, what do you do about it? What's the solution for that? When it's really severe, an orthopedic surgeon will do what's called a laminoplasty, which is basically neck surgery. And, if you have severe compression of the spinal cord, laminoplasty can help that if it's severe. The problem is, according to this article, is that laminoplasty does not improve neck pain. It just doesn't. So, and then it says, in patients exhibiting significant spondylitic alterations, which means osteoarthritis, DCM, and factors contributing to dynamic spinal cord compression, laminectomy alone may be insufficient for addressing axial neck pain. Well, what is sufficient? What do you do then? Well, chiropractic care. That's what I would recommend. Now, these authors might be thinking about cortisone injections, which has its own set of problems, or painkillers, again, which have their own set of problems. But all of these things that this article is talking about with degenerative cervical myelopathy can be prevented with chiropractic care. You start chiropractic care early enough in the process, or just before you have neck pain, a lot of this can be prevented. And so that's what we're about in this office. We're about preventing things like this, cervical myelopathy, about degenerative disc disease, about preventing joint replacements like knee and hip replacements. That's one of the things that we're about. So all of you out there that are listening to this 10 Minutes of Truth, if you or other people are developing neck pain, and they're not seeing a chiropractor, not doing anything about it, or they're just taking like Tylenol or pharmaceuticals, have them at least get checked by a chiropractor. Have them get checked by me. We do that at our expense. It takes about 10 minutes. And I can tell you, this is what I found, this is what we need to do to fix it, or this is where you need to go to get it fixed. And we'll do that for you. Those people that have neck pain that are not doing anything about it, they're heading down a pathway that's really going to cause them problems as they get older. And here's the thing, you don't have to have those problems. So this is Dr. Paul Firnhaber at Lincoln Disc and Nutrition here in Lincoln, Nebraska. Our number is 402-488-2220. And if you'd like to come in and discuss this with me further, give Carmen a call and she will schedule you for it. In the meantime, have a great and safe week.